Babies have died after a Klebsiella pneumonia outbreak at the Thelle Mogoerane Regional Hospital in Vosloorus. The Gauteng Health Department has confirmed that 7 infants contracted the bacterial infection in the hospital's neonatal ward last month. ENCA's Masego Ratlaga is covering that story and joins me now. Good evening, Masego. Thanks very much for your time. So you spoke to the family, in fact, the mother of one of the infants. How are they coping?
Well, Vuyo, we spoke to a mother and a grandmother of another family. They're not coping. Actually, at some point, the mother asked that she not be spoken to on camera because of how she just wasn't comfortable with how emotional she was. The death happened very recently, in July. She says that, she was planning. She had planned and bought clothes, the usual things that you buy when you're expecting a baby. And she had recently applied for leave, of course, at work, maternity leave, excited, telling stories with her baby's father and her mother about, the type of stuff that the baby might do, when you think, oh, if the baby's going to touch those flowers as the grandmother, I'm going to hit her, just know I'm going to hit her. And now they have to just accept that she won't be with them. They don't know what to do with all the clothes that they bought for that baby. And of course, it's just a huge emotional toll on the entire family.
Are they getting any help, assistance from the authorities?
Well, actually, they're not getting any assistance from the authorities at the moment. The mother of the baby, as well as the father of that baby, actually had to sought assistance from one of their parents. So that's how they are getting their counseling, from privately getting some assistance. But in terms of the Gauteng Health Department or the hospital itself offering them any counseling, not at the moment.
Educate us a little, Masego, just about, the Klebsiella pneumonia. What is it and who does it affect? Who is at risk?
Well, when I asked doctors and nurses about it, of course, because I wanted to understand, is this an outbreak? Should we be worried? They actually explained that it's a bacteria that is in every human being's system. It stays in the feces. And Vuyo, basically what they said is that the reason why the babies are passing away or have passed away is because the nurses say that they are short-staffed. And there's a certain way when a baby is still an infant and is born, there's a certain method that the nurses need to use in terms of the antibiotics that they give the baby through either the drips, probably. So now if you're understaffed, for instance, the law says the ratio is supposed to be 1 to 5. And if you're understaffed, then, if there's like 100 babies in one ward and there's only 5 of you, that means you're looking after 20 children. By the time you get to the 6th child, you've been working for over 6 hours, apparently. So then some kids skip that method that the nurses are supposed to use, and of course their system is not as strong as a person who's grown up, and therefore they are not able to the system is not able to resist any bacteria that's not supposed to come into it, and therefore they get infected badly and pass away.
So how we manage our healthcare facilities can actually contribute to the spread of it.
Definitely. I was told by the CEO of Thelle Mogoerane Hospital that it's a bacteria that can spread even from just the floors. Just by us walking on the floors, it can get into your system. So now if you're a newborn baby and your system is not as strong as a person who's older, of course, and has developed a stronger system, you're not able to fight it. So if you're a newborn baby and you're not given those antibiotics on time and at a time that you're supposed to, and there's one that's skipped or anything, then you're in trouble. So that's what the problem is. And the CEO actually saying that they're going to try scraping the entire unit to try and see if maybe there's any of the bacteria on their equipment or on their floors or anywhere around there. But the nurses were actually telling me that they are sometimes short of something as simple as the sanitizer for a couple of weeks or a couple of months, and something as simple as the towel, the special towel to wipe. And therefore, if you don't have that and you're getting into a neonatal ward, you put those children in danger. On top of that, they are not following the proper procedure holistically in terms of giving these children the antibiotics that they need to fight any bacteria. So added to that, the hygiene is also not taken care of, and therefore it's really just inevitable. They say some of these patients die when they're not supposed to. You know, it's not time for them to pass away, but they do because they're short-staffed, they don't have enough of the stuff that they need to protect these patients, and on top of that, they don't have enough instruments sometimes to be able to perform their duties.
You don't know if any of NGOs or lobby groups have sort of, taken an interest in this, because as simple as some of these things may sound, often you'll find that unless someone takes the government either to court, or mobilizes, nothing gets done about these things, and people die unnecessarily.
At the moment, there is no organization that's taking this forward. It's a problem that is around a lot of these health facilities, and what we do have is the Nursing Indaba, and that is a union for nurses, and actually the nurses have taken the problem into their own hands. How the story actually came to our attention as the media is the fact that nurses at Thelle Mogoerane decided on Tuesday that they would down tools and just abandon their posts so that they are listened to, because they
draw
say
the attention
to draw the attention. Exactly, and that's how actually we started to know of the story and and then there was reaction from government. The MEC, for instance, of Gauteng Health, Dr. Gwen Ramokgopa, went to the hospital yesterday, but of course the nurses are saying this is reactionary. We've been complaining for a couple of months that there are sometimes things that we need to have that we don't have, and we're told that the department simply doesn't have money, and people die, and therefore we're forced to abandon our posts, to force you guys to then come and listen to us and actually take our grievances seriously.
Well, let's hope that someone does indeed listen. Mosegora Hlaga, thanks very much for your time. She is, of course, tracking that story. As you heard from her, it took the courage of nurses who downed tools in order to draw people's attention to that plight. Hopefully, someone out there who can do something about the plight of these children is, in fact, taking note and will be able to do something about it, given how the authorities seem to be